Different types of scars manifest as hypertrophic or elevated above the level of the skin. Keloidal scar, keloids, which behave like tumors and they grow beyond the area of the initial injury. Or atrophic, meaning they are depressed below the level of the skin. Causes of scars are multiple. So scars can develop due to trauma, let's say a car accident or a fall or an injury or a fight, and that trauma can cut the skin, and as the skin heals, it heals with a scar that might be noticeable and annoying. They can result from some skin diseases, notably acne. Acne scars is something I treat in my clinic regularly and on daily basis. Acne can leave very obvious, very severe, and very disfiguring scars. Other diseases like chickenpox can leave scars, or lupus can leave scars, but acne is a very common cause of scarring. And then we have surgery. Surgical procedures like, abdominoplasty, breast reduction, facelifts, removal of skin cancers, any type of surgery where the skin is cut by a surgeon can also lead to scars which are very bothersome to the patient and would require treatment. When patients come for a scar consultation with me at Dermasurge, I typically assess the scars, their location, their depth, their type, and then I ask the patient questions about, are they itchy, are they painful, are they limiting movement in some sort, let's say scars around the mouth or on the limbs. Can be, in addition to being disfiguring or psychologically traumatizing, they can also limit movement or function, let's say opening the eyes, opening the mouth, moving the hands or the arms. And then I classify them and I give the patient a treatment plan based on those scars. And the treatment plan that I give after the consultation is very detailed, which would include the different things I would recommend, whether it's prescription creams to reduce the hyperpigmentation or promote pigmentation in hypopigmented, lighter than skin scars. It would involve any surgical procedures that I would recommend, any lasers, and a combination of different lasers, because I utilize multiple lasers in the clinic to address different scars and sometimes a combination of lasers. It would also include other procedures as deemed necessary, like skin boosters or injectables. I utilize different treatment options based on my assessment of the scar during the consultation. Those might include surgical options, laser treatments, and other treatments in addition to those two. Many times I combine different procedures in treating the scars in one patient, as the combination of treatment yields better results. So surgical options might include something called subcision, which is lifting off scars that are fibrotic and being pulled down. This is typical in rolling acne scars, and it involves local anesthetic and a needle going under the skin, a special needle that cuts the fibrosis and thereby lifts the skin, the scarred skin up. They might include cutting the whole scar, excision of scar or punch excision, sometimes replacing an ugly scar with a linear, thin, cosmetically appealing scar. And then I utilize different laser treatments, which might include the vascular laser and the IPL laser to address the redness in a scar and the irritation and the itching in a scar, and also fractional lasers. And I have different types of fractional lasers. I have an ablative CO2 laser and a non-ablative fractional resurfacing laser, sometimes in combination, sometimes one after the other. And also the treatment option might include adding things like skin boosters, including platelet-rich plasma, polynucleotides, or fillers in some scars to lift them up and fill the depression and loss of volume. And finally, in addition, I might prescribe some creams that might help the pigmentation in scars or even help pigment scars that are whiter than the normal skin, and also to stimulate the collagen. Scars are a very common problem. In addition, scars cause severe effects on mental health. They can cause anxiety, depression, social withdrawal. They can affect relationships and they can affect social life. If you're struggling with scars, do reach out. I treat scars on a daily basis, and many scars can be improved to the point where you feel more confident. They might reach a stage where they're not visible anymore, even though they might require a few sessions of laser or a combination of treatments, but treatment exists and is effective and can definitely improve your quality of life and your mental health.